by talking a little bit about the agenda for me. Just gonna talk a little bit about me, each of the areas that I had to train, and then to tell you more about the work that I do. I'm not what you would say like a traditional physician, but I do have traditional roles as a physician. So I do see patients, I have clinics, I take care of all of that, but that's a certain percent of my work. And I would like to invite you to think about what you want to do in medicine beyond patient care. Because as a physician, you're going to be a leader and you're going to have a lot of independence to do many things. But not everyone will remind you about that. They'll say, let's go to the hospital, take care of your patients, because that's basically the moneymaker, and that will always be there for you. But I invite you to think about if you want to do research, if you want to create new technologies, if you want to revolutionize the healthcare field. We need that. We need you guys, and I want to support all aspects of medicine that you can develop. And so I have a non-traditional aspect that you can learn from, and of course ask questions. And so, what can I say about myself? I would say that I was always very enthusiastic to learn. I didn't really know what I wanted to do until I was midway in college, because everything was interesting to me. And then when I went to medical school, I didn't know what I wanted to specialize in because everything was interesting to me. So I found it all quite interesting. But the main things I think that you should think about as an individual and as a professional is your purpose, and then the dynamics that support that purpose. So sometimes, you know, it's pretty obvious. It feels like this is what I want to do. This is the reason. Sometimes it's a little bit gray, a little bit unclear, but don't let anyone give you your purpose. Develop it. You can swap it out. You can say, you know, this felt good, but not anymore, or I kind of want to change it, so you can repurpose, if you will, your purpose, but have a purpose. Think about what you want to achieve as a professional for yourself, as an individual, and then for the community. And then see how you can do that already, right now, like in your day, that you meet that purpose, even if it's small, because you'll be doing that throughout your career. It will help you as a doctor to say, is this feeling right to me? Do I need to change? Is this kind of getting stale? Or do I need more challenges? Or is this overwhelming? And now I want to kind of modify my purpose. But think about your purpose, and then think about, just as important, the dynamics that support you. So what are the types of environments where you thrive, where you feel most enthusiastic, where you feel like, yes, I can actually study in a room like this, or I can actually learn in an environment like this. Protect those dynamics as soon as you identify them, because you'll be learning them right now in your current career and your education. What makes you feel supported? What helps you to develop things that you need to develop now? And so what did I decide my purpose was? It was definitely to be in medicine, but more importantly, to redesign health, to provide new aspects of health to my patients, and to provide new aspects of health, even perhaps undeveloped yet, in my field. And so that was my purpose, like to innovate in medicine. And what are the dynamics that support me? I like a lot of variety. So I like to learn all the time. I love meeting people. I love teaching and learning. So I knew that that was important for my field. I need to be involved in teaching, and I need to be in a field that's ever changing. So I couldn't see myself being, you know, super specialized, seeing like the same renal patients. I was probably gonna get bored. So I knew that that was important for my field. So I'm gonna give you like 10 seconds to think about if you feel like you're connected to your purpose, if you have one, and then if you thought about dynamics while I go to the next slide. Purpose, dynamics. So what are some other things that I think are interesting about me is that somehow I'm an island person. So I was born in New York City, grew up in Manhattan, an island, and then my family comes from two very opposing islands. My mom is from the Dominican Republic, and my dad is from Norway. So a very cold island, very hot island, very messy, crazy island. So, but I'm in LA, which is not an island, but it does feel a lot island-like to me, I suppose. It speaks to my ancestry. But it's been very interesting to realize how much New York has influenced me as a professional growing up in that environment. I do have a little New York sass, but it is very quiet. It is very settled. I'm not defending and fighting every single thing, but New Yorkers are definitely ready for a fight. Is anyone from New York? All right, what do you say? Do you agree?
Yeah.
Did you get like overwhelmed, like, oh my God, New Yorker, what's up?
No, I love meeting New Yorkers.
Yes, New York, New York. What part of New York are you from?
Long Island.
Long Island, the LI, that's amazing. Yes, I love Long Island. I lived for a short period of time in the, let's see, it was called Well, it was right across from the Long Island Sound, so it was the northern part,
Yeah.
but not as far out as the Hamptons. It was Sound Beach, the Sound Beach area. So,
Oh, that's
are you familiar
yeah,
with it?
yeah. That's super close to me.
Very nice.
I'm in
yes.
Comac. If you
Oh
know.
my gosh, yes,
Yeah.
yes,
So
very
sweet.
nice. So keep it alive for New Yorkers. You know, we have to let people from Southern California know that we are functional. It's not as crazy as it is alleged to be in New York, but definitely a great environment to just meet a lot of different people. So I knew that that influenced the way I wanted to work. And then having Caribbean, Latinx background, and then also some kind of crazy European sort of thing, all mixed up into, you know, what you see today. And so I pull from that often. So whatever you feel sort of defines you, defines your experiences you were growing up, is something that your patients will really appreciate. So some things that I love, I definitely fell in love when I came to Southern California when I saw the combination of mountains and ocean. It's very similar to where my family comes from, Dominican Republic and Norway. So I knew that this was a good spot for me. I also loved just the aspect of being able to see endless like sand and ocean beds north and south along the coast. I totally love that. I do love Latin dancing, and I did a little bit of semi-professional dancing when I was in college. So if you want to do anything semi-professional, this might be the time to do it. Not necessarily if you're super busy, but you can definitely look into advancing your entertainment to get some, you know, recognition if you like. I also find that cooking outdoors makes food taste better. Does anyone agree? Like outdoors looks like a couple head nods. So how lucky are we to live in Southern California where you can do anything outside and cook? So anytime I can bring a little pot around, you know, make a little bonfire or a little electric grill, I do so. I actually bought a Wrangler Jeep that has a little plug-in, so I can just drive around somewhere and make some s'mores or something in the back of the car. Totally recommend it. And then this is my dog Wicked. He has a fellowship because he was with me during fellowship. So he's an honorary physician, I guess, because he supports my sanity. But it's really different things that have contributed to my development here at UCLA and my career. So I just wanted to share some of those loves. And then in terms of my path to medical school, so I went to University of Miami, and in college, I wouldn't say that I was super confident. I would say I love knowledge, but I was kind of scared to like stand out too much. I felt a little bit like nerdy, I guess. But I developed my confidence because I knew that I wanted to do something important once I figured out that I wanted to be a physician. I learned to actually learn and like actually study. I found high school and prior education to be just super easy. Like I really didn't have to think about it. So I was like, oh my gosh, like I have to study, like this is new, you know? So I learned all that, and that was good. So if you're feeling that way, like, oh my gosh, this is crazy, like this is a lot more difficult, perfect, because that will help you for medical school, because no matter how easy undergrad is, medical school is a whole nother level. There's no one that thinks medical school is easy. If anyone told you that, you're wrong. They're trying to brag, or they're trying to be like, oh, you know, like, I don't even eat sugar, I hate cake. I also think medical school is super easy. Yeah, they're totally wrong, they're totally off. It's definitely a challenge, and it's definitely enjoyable. I never learned so much information in such a short period of time than in medical school. It was totally worth it. One of my memories is sleeping on a table just like this in the study room. Like I refused to leave the building sometimes when I was studying. I'm not sure that was necessary, but it did something to me psychologically. I feel like I absorbed better, like just staying here, laying on the table instead of going home, having shorter intervals between studies. But I wouldn't necessarily recommend that, but that was my path to medical school, and I went to medical school at Chicago Med School. I actually lived right behind this building, so if you look at the Chicago skyline, there's a new building. It's not built in this picture, but it's right behind this diamond-shaped thing. This is the Loop. Is anyone from Chicago? No one from Chicago? Anyone from the Midwest? Anyone traveled to Chicago? No Chicago. Okay, all right. Do you guys know the Loop? All right, yeah, so that's basically the area. Do you like Chicago? Fans or not really? Yeah, so. Yes, looks like yes. And so. Why so? Interested.
A little too humid for me.
Okay, all right. It can be humid. It's the worst cold that I think I've ever experienced in my life, living, because I've experienced travel cold, but it was very impressive. I thought, yeah, as a New Yorker, winter's there, but Chicago, it was way worse in Chicago. Very. I remember a door of my car being completely covered in ice, and I was like, hello? Like, I was just looking around like, what do we do about this? Like, can anybody help? Like, I don't know what you do when there's a big, like, 2-inch block of ice covering, like, the whole door. But a neighbor saw me, like, confused and helped me chip through it. And then I learned to have a little ice chipper, like, crazy. I also learned about frozen secretions. So one time I was like, what's in my nose? Like, don't touch it, don't touch it. The temperature has lowered so much that your nostril fluids are now frozen. If you touch them, you will bleed. So I was like, okay, yeah, pretty bad. But I would say that in environments like that, like in Norway, people really bond. People really support each other. When you're in a place like Southern California, you don't really meet anybody. You just enjoy yourself. So, it's, two-sided. But that was my path to residency in medical school. And then I went to residency at State University of New York. So I did pediatric residency there. I decided that I was going to prioritize community health and safety net hospitals. So State University of New York is the state hospital of New York. Anything you could think of about a state hospital was true about there. Like, super scrappy, tons of patients, tons of needs. And I said, yeah, let me train in a place where I can see all kinds of patients with a lot of need so that I can help support, the dynamics of medicine. And then when I took care of some patients in a clinic in Brooklyn, because that's one of the major clinical sites that I had, I found that a lot of patients that I was trying to help had too much difficulty with just the basics. So here I am prescribing antibiotics, checking their ears, giving them asthma action plans with their little asthma pump, but they really needed what you guys helped them with. Housing, they needed a way to get their medication, they needed transportation, and so here I am, giving them this whole spiel about medical things, but there was no way that they could meet their medical needs because their basic needs were not met. And I got really frustrated because I said, wait, I came to State University of New York, safety net hospital of the country. Like, you guys have been around for hundreds of years. We're having these issues and we don't have options for them. And so they said, well, we can only do what the health policies allow us to do. So if you want to figure out how to help patients more in that sense, go to the policymakers, find out what they're doing, and then you'll see that it's not as easy as you think. So I went to a policymaker meeting and I was really shocked because it was about 12 politicians representing the Brooklyn area, and none of them were doctors, none of them were nurses, none of them were social workers. They were like parents, older folks talking about healthcare decisions that they didn't actually know a lot about. They were having conversations that felt like it was from the 1950s. I was like, oh my gosh, this is crazy. So I raised my hand weakly in the back and said, it's comment period. I didn't mean to make comments, but I just want to share XYZ. I am training here. I'm first year resident. I have a clinic in Brooklyn, just a couple blocks from here, and these are my opinions about some of the decisions that you're trying to make. I think this would be better. And they freaked out. They're like, a doctor? Like, no, I'm in process. Like, no, come here. Let's show you all these things that we want to do about elderly health, about pregnant persons, about general dental access. I'm like, I don't know anything about that. I can tell you what I think, but I don't have expertise in that. But it didn't matter. I think they just went with any decision that I said, and I started to get uncomfortable. And I went back to my program and I said, guys, people that have no medical experience are making medical decisions for this whole community. How is that even possible? And they said, well, that's democracy. So I told them, I really want to work in this space. I really want to change the way people consume health and to support them to have better health. So what can I do? So one thing that we did was we created a track for people that were interested in this, and now everyone in the program in pediatrics goes to policymaker meetings, helps with policy. But they told me about preventive medicine as a training program. So they said, we like this stuff so much, maybe you should actually train in it. Preventive medicine is a systems-based view. It's a population health view. If you want to make changes about policy or you want to create new health system solutions, that's a place to train. Excuse my earring, got so excited about my path to fellowship. And so that's what ended up taking me into preventive medicine. And preventive medicine has been incredible. That's what brought me here to UCLA. I found out that here at UCLA, they're doing amazing things in the pediatric space. And that is what links me up to Dr. Kuo, who links me up to your program. And so now that I am here and I did my training and fellowship, I was invited to stay on and to continue the work that I did as a fellow. And it was incredible because it met my purpose and then the dynamics that I wanted. I could help the community create new solutions, but then also have opportunities to be with you guys, to teach doctors, to teach residents, to develop curricula, to work on health policy, and to do work in the community. And so I'll show you a little bit more about what I'm doing in my career. So some of the things that I do, besides talk to amazing doctors in training like you, is to also help Los Angeles Department of Public Health. So whenever they have an issue with lots of fevers or lots of issues with contraception or anything that they're starting to see as an emerging problem in Southern California and in LA County, they reach out to the preventive medicine team here at UCLA to ask us for advice. So we look at the information, and as a preventive medicine trained doctor, I can look at a lot of numbers and look at a lot of information and say, this looks good. This looks like we're on a good track, or this looks really bad. We have to do something about this. So I can help them interpret. And then based on that information, we do community-based research in Los Angeles. So if they say, we're finding that people that are of Latinx community are not really going to their primary care provider, we go speak to them. And we develop solutions. We do little pilot projects, maybe of 100 or 200 patients, see if it actually works, whatever we're trying to provide, and then present it to LA County and say, maybe you should enlist in a program like this. We can help you create a program like this. And some of those programs have become part of LA County's initiatives, which we're super proud of. Not me by myself, a whole medical team. So people with different expertise. But when they have pediatric questions, they generally ask me about that. Here's some examples of the community-based research that I do. So one of the projects that I'm working on is helping to support patients with limited English proficiency. And so that means, either they don't speak any English or they just don't prefer English for medical information. So they can speak communication, all that's fine, but when you want to explain something important about their body or their health, English is not their preferred. Maybe it's American Sign Language, maybe it's even just written. They just want to read it. They don't want to be told in technical terms. And so we are providing training and development for curricula in residency programs and just helping doctors to be able to support patients of this population because they have a lot of issues with their health outcomes that's disproportionate. We're always supporting individuals with physical and intellectual disabilities as well. So really seeing what are their issues in LA County and how we can support them to be better linked to resources and to better support their needs in LA County. We're always working with youth health prevention initiatives, so trauma research, community-based trauma research, ACEs, if you've heard of ACEs, or adverse childhood experiences. The mental health issues in our youth is like unsurpassed. It's the worst it's ever been, at least since we've been measuring it. So it's something we're always working on. I also work with the Infant and Maternal Child Health Center of Excellence to help promote health for this community. And then we're always working with the prevention initiatives at LA County. And so for the clinical side, you might ask, okay, you're doing all this teaching, you're working, in LA County and doing all this advising. What do you do in your clinics? So these are 4 different buckets of what I do in clinic. The first is a neurodiversity clinic. So I see people of all ages, from really, really tiny infants all the way to the elderly that have autism, ADHD, learning tendencies, and I help to advise them on how to support their lives, to educate them about their brain time. If they need medication, I manage it. If they have health needs, I manage it. And a lot of the patients there, I become their PCP because I can also do general preventive medicine. We also have a clinic at the Department of Public Health, so we support anyone who's having issues that come up to the clinic, so we do some service there. And then I do general primary care and pediatrics, as well as lifestyle medicine, which is ways for you to do behavioral change to support your overall health. And so seeing different age groups, seeing different, from prevention to actual disease. And so because I love to keep it moving and I love to have, diversity, it all helps me to have a fulfilling career. And so some of the tips that I want to share with you that really helped me, that evolved through my time as a doctor in training, first is to know yourself. So it's really important for you to be honest with yourself about how you're comfortable and how you're uncomfortable. Don't fight it. Don't say, oh my God, I should be able to memorize everything, or I should be. Just know what you can do. It's okay. You can improve that, but you can improve it when you embrace it and when you have peace with it and say, look, I'm just a visual person. They can talk all they want. I need a graph. I'm gonna get a graph. I'm gonna get someone who can visualize this for me. When you're in medical school, and also maybe experiencing this now, somebody can just say one phrase and make it make sense for you. So really know yourself and know what you need. As as a doctor, you're your own entity. You're basically a business, an enterprise walking around. Like, you're a doctor so-and-so, you're a doctor so-and-so. So who are you? Know that. And you're gonna learn that through your career, of course. But what you know about yourself now, protect it, honor it. It's okay. Like, sometimes you know some crappy things. Like, oh my gosh, like, if I don't have a nap, I'll probably like punch somebody in the tooth. I don't know, something like that. That's okay. Embrace it. If you want to change it, it's easier to change it if you embrace it. So give yourself grace. Basically, whatever you feel is your challenge or whatever you feel needs to improve, have grace with it, because that's what your patients are going to need. If you're brutalizing yourself all the way through your career, you're going to be really unhappy, and your patients are going to be like, wow, that doctor is irritable and irritated, and I'm going to just not get in their way, kind of thing. Which some doctors are very successful practicing with that, but I'd say there's a better way to be graceful to yourself. Remember, you're never alone. So this field is no longer an independent practice. Although you're an independent entity, you have your license that you have to protect, you're also with a team always. So if you ever run into a new patient situation, call your colleagues, talk to other colleagues, find someone that can support you, because that's what medicine is all about. It's collaboration. It's too complicated to do alone. And then ask for what you need. Please ask for what you need. This is the main thing that had some of my colleagues not make it through the fields. They were too embarrassed to say, I don't get it. I'm totally failing. I didn't pass that test. I did this. Like, ask for what you need. Don't be embarrassed. This is your journey. This is yours. You're never going to recreate this again. If you trip, that's okay. You fall down, get some support to get up if you need it, but whatever you need, ask for it. Everyone that was successful in the medical field that I observed, they were always asking. They were bold, like, hey, you, help me. You got a bottle of water there? Can I have some? You know, that kind of thing. Like, are you serious? And so depending on how you grew up, you know, your cultural views about giving help or asking for help, it can really interfere. So someone may have the very like worksheet that's helping everyone pass that test, but it's like, I don't even know, what do they do? I don't want to ask. I want to like just do my own thing here. I'll just do my own thing here. That's not medicine. It's collaborative. Reach out and ask for what you need. And then, I was discussing this a little bit with one of your leaders here, think like a doctor, but do that now. So if you ever feel like, I can't get through this class, or maybe it's NCAT time, you know, that sort of thing, think about the NCAT like it's your patient. Think about topics that are difficult like if it's your patient. What would you do if it's your patient? How would you address it? You probably take a breath, stay a little calm. They look bloody, their like nose is blowing up and everything. You can't scream, you can't run away. They're your patient. So let's just, okay, all right, let's just embrace you. Let's give you grace. Let's give myself grace, and let's figure out how to help you. If you feed that part of you, you'll always have a good sense of how to direct yourself, because as a doctor, you will walk into a room where you don't know what to do. But if you say, okay, think like a doctor. I have the information, I'm gonna work with what I can, and I'm gonna make the best out of it. It's the best way to approach it. And so these are my tips. That's my little story. And let me see, how much time do I have? I don't even have a clock here. Oh, I see it. So we have some time for questions. Anyone have questions or thoughts about this? Anything I can help enlighten you while you're currently thinking about the field? Or questions about my trajectory or any of these tips? Yeah?
Hi, I'm Sean.
Hi, Sean. Nice to meet you.
Geez, sorry, my voice.
Is it okay?
I was wondering if in your like public health work, did you do any work with like fielding or with Ash Center?
Yes, so we did work with fielding on some small projects. We did have, for example, the Infant and Maternal Center of Excellence has a home in fielding. And so we had some students who did some training programs that helped us with some of the research data collection there. There are some other colleagues that I have that do some collaboration with public health students. So it's definitely there. There's not a big branch where like you go into that and that's where you work with us, but we're kind of like infiltrated based on the physician's interest. But yes, we do work with public health students and also teach them. So if you see any PredMed doctors or UCLA doctors, they can probably help you to develop project ideas and talk to you about the profession.
Awesome, thank you.
You're welcome.
Hi, I'm Suragi.
Hi, Sophie.
Did you feel any hesitance like going into like you said, like a more like untraditional trajectory, and like if so, like how did you overcome that feeling?
Sure, yeah, great question. I did. I think it's easier to do what everyone else is doing. And so to be honest with myself, like that's what I knew. I was like, I don't want to just go to a clinic like from 6 a.m. to 7 p.m. every day. Like I want to do some innovative things, and I want to see my community, and I want to be sort of a community doctor. So it was asking the right questions to the right people to see if it made sense, because you can have all kinds of beautiful dreams in your head, I guess, but someone may say, you know, that you can do that, but you might need to do this first. So kind of getting some guidance about non-traditional paths is really helpful. So you don't recreate the wheel and then like run into trouble, and people are like, oh yeah, if you would ask me, I would have told you that was going to be tough, or that you know, institute is not going to support that. So it's asking questions, really getting out there and saying what you need in the environment where people are actually developing things. If you go to like a traditional space, it probably won't be the best place to develop a non-traditional field. I would say not 100%, but as a general paradigm in my life, I find that the West Coast is very innovative and the East Coast is a little bit more like, we are what we are and we will always be this way. So if you're thinking about non-traditional, West Coast is very supportive of it when you're doing medical training. East Coast can do it, but you have to find the right institution or the right clinical space where they want you to do that and they'll support you to do that. And then PrevMed is a great training program to innovate. So yeah, that's how I dealt with it. When you know what you want, communicate it often, bring it up to your mentors, and find mentors that inspire you so that they can help to guide you. Don't find mentors that like make you miserable because they may crush your dreams, and you don't have to listen to someone who's going to crush your dreams, but someone who's practical and gives you a good timeline and practical advice so you can avoid unnecessary issues.
Thank you.
You're welcome. Any other questions? Oh, yes.
Hi, thank you for your presentation. I'm Jessica, by the way.
Hi, Jessica.
For the people who are a little bit hesitant about even going with the pre-med route or becoming a physician, like, what are some of your like motivation that kind of got you through those late night studies, like the difficult exams?
Beautiful. What a great question. So I would say for pre-med hesitant folks, I would ask, what's drawing you to medicine? And can you find that anywhere? If the medical field is the only place you can find it, you belong here. If you can find it somewhere else, doesn't mean you don't belong here. But if you're like, oh, I don't know, it's okay to explore other things. Some people have a totally different career and then they come to medicine. Totally fine, it's your life. So if someone is hesitant, I would ask what they want and then what's actually making them scared. Some people will say like, ugh, I just don't want to be in school that long. That's not a reason. That's not a reason. For me, that's not a reason. We are going to be working for the rest of our lives, guys, like really. So what's 2 or 3 years more of learning something that's actually going to help you work in the space you want? It's nothing. It goes by like this. I'm so sorry to say, like, I'm old. So like, I can feel like that it went by so fast, but it goes by so fast. It's like, okay, fine. So work in another field for a couple of years extra. You'll probably end up coming right back to medicine because you'll see that it's not as satisfying. Others will say, you know, oh, it's too much work. Listen, the work is coming, like it's coming. You have to do work. Like a person who's in this building cleaning after hours, that's a lot of work. That's a lot of work. Will we say, oh my gosh, it's so intensive, it's the same as being a doctor? No, but it's work. They're like here all night, going home late, you know, maybe having issues paying the bills. Like we choose our work. So the work is coming, the challenges are coming, but make sure that it's where you want to be, the space that you want to develop, and that you're creating the path that you want for your life. So if you want to be in the medical field, some people will say, well, I could be a nurse, you have to be a nurse practitioner. Being a physician is being the leader, is being the person that chooses, is being the person that guides everything. So if you want a happy clinic, it's yours. If you want a stressful clinic, it's yours. If you're the nurse, you support what the doctor is. And so if you are okay with that or you feel more comfortable, fine. But I would say no. You guys are all brilliant. You guys are all leaders. You create medicine and the medicine that you want. So if you want to be, you know, a lecturer, an author, a scientist, you can do everything with your degree. Like with other degrees, they're all like limited. So I would say if you like medicine, go for the goal. Let's go all the way. It's totally worth it. It's just a couple extra years. And I have a good colleague who she's like a doctor of nurse practitioner. So she did all the nursing, then she did nurse practitioner, then she did a doctorate of it. And it's like, you went to school almost longer than I did, and you probably have as much knowledge as I, like, you should have just been a doctor. Like, it would have been easier, you don't have to sign off to me, you know, so that sort of thing. So I would say the leadership aspect is so powerful in medicine, and the path into the medical fields is totally worth it if it's something that you want to do. And if you're trying to compare it to other things, I feel like it's almost the same when you like break it down. So someone will go to undergrad for 4 years and then go out to work in like business space. They're struggling as much as we are, but just in different ways. So struggle where you will be happy. Struggle where you're building something you want, not where it's just easier because right now it's easier. That's what I would say. None of the colleagues I have regret it. They now say, oh, I shouldn't have done 8 years of school. Oh my God, why did I do fellowship? Oh, so we're all like, yes, time for independence, bring it on. And that's what I have to offer to you. Do what you want in medicine. When you go and you train and you learn the things you need to learn, make it what you want, not what anyone wants, what you want. You want to be an innovator? Innovate. You want to be a clinician? Be a clinician. You want to work in a little community clinic and deal with people that are just like your family members? Go for it. You have the aspects and the resources to do that. Otherwise, then it's more like, what am I doing here? So in medicine and as a doctor, you can actually create everything you like, and you can change in stages. Like I have people that did clinical work, and then after that, they just switched totally to research, and then went back to clinical work. As a physician, you have that freedom, which is really wonderful. I think it really pays for itself in that way. And then, you actually make some money eventually. It's like not like so much. Don't know any super rich doctors except for like, those really, 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 really high surgical folks, but you still make excellent money, and you have the independence to do it in the way that you want to do it, and you can change it throughout your career. Other questions yet?
Yeah, so you mentioned that you found your niche through preventative medicine, like blending both public health-facing work and medicine, but I think a lot of our students are interested in those fields and are deciding whether to be pre-med or not even in the first place. So what other niches can you find besides preventative medicine? So let's say you want to go into like internal medicine or family medicine. Like what success stories have you seen there?
And that's in the public health space?
Yes.
Yeah, so absolutely. It doesn't matter what specialty you choose. You can work in public health 100%. So you can be an internist or internal medicine doctor, and you can collaborate with the county to do work with the county. Or you can do public health work within the hospital if they're a community hospital or if they have community initiatives. So some of the UCLA doctors that do public health work, they're in a department called Quality. I don't know if you guys have heard of that. It's like all this technical stuff. But what they do is they look over the health of everyone that's treated at UCLA. So all the patients that have ever come into the hospital or clinic, they look at their health and they create programs for those patients to keep them healthy. So they may look at, wow, we don't have enough colonoscopy screening, what's going on? And then they do basically the same thing I'm doing with the department, but within UCLA. They call up patients, they get some researchers to kind of do some surveys, evaluate patients, and then find that they're scared of colonoscopy, or they'd rather do, the FIT test, the one that they can do at home. So now they have evidence to like pay for a bunch of FIT tests, try that out, and maybe that increases screening. So internal medicine doctors do it, emergency medicine doctors do it, cardiologists do it. If you want to work in public health, you can certainly do it. I would say if you don't do preventive medicine, when you're a resident, start looking at your community-based public health system and start to collaborate, make projects with them so they know you and it's easier. If they don't know you, then it takes a little more time once you finish your training, but you can totally do it. You don't have to choose. You can actually have it all, guys. You do public health, research, and be a physician. I wouldn't choose. I would just take it all. I would say don't choose unless you have really big concerns about the medical field. That's okay. I can answer those questions if you have them. But make sure you put to light, know yourself, put all that to light. What am I afraid of? What does this field really stress me out about? And can I handle it? Or am I just gonna run into it in another field? Because that's what ends up happening. I have colleagues that were on the medical track, they switch and they're like, dang, I went into finance and like, this is so crappy. Like I would have been just fine in medicine. I don't know why I switched. So make sure if you switch, you do it in a very sound way. And if you haven't explored it, we're here to support you.
Hi, this is my third time actually listening to your presentation, and I feel like I always get something out of it, so
Great.
I'm
Oh my
always
gosh,
very
that's wonderful.
appreciative.
Thank you for like sticking around for 3 times. My goodness. Thank you.
I have a question that kind of builds off of Sean's, but for those of us who are kind of interested in a career that intersects like medicine, public health, maybe like public policy and like community research, do you have any tips on how we, like at our current stage as we're considering grad school, how we can get more experience or like seek out mentorship, or like kind of like dip our toes first into like seeing what we're specifically more interested in?
Yeah, absolutely. There are plenty of ways to do it. First way, I'm here, so we can chat anytime. Guys, gals, everybody, we can talk. Depending on what you're interested in, if you've developed interest, we can link you up to people who are doing similar work. One really interesting place, an easy place, are conferences and research conferences. So you can look at what research is being done and ask them, yeah, it looks like this is a doctor doing research in the community when it comes to cardiovascular health. How did you do that? You know, do you use undergraduate or medical students to support your work? Most of the time we do. If it's a big project, for sure we do. So it's an opportunity to meet more people and to get more information about, you know, what their project is made out of and if that's something that you want to do. But it's really getting out there and meeting people, which is really tough these days. I know with like, we're so isolated, a lot of stuff is remote, but like get out there into the spaces that have some of the things you're interested in, and that can certainly help you. And then linking up to someone who's actually working actively in it, which you have at least one, and then I represent a group of about 7 doctors, so you have all of them as well. And so we can, you know, as your interests come up, we can definitely have, even if it's a 20-minute chat with them, that you can see, you know, what they do and how you can get involved. We usually have ways, if you don't need to get paid, but there are ways that we can link you up to opportunities, or at least to have some insight about what it looks like.
Thank you.
You're welcome. Yeah, I'm glad that you are getting stuff after 3 times. Oh my gosh, I'm a little embarrassed about you sitting in this talk 3 times, but thank you for your grace. You're very graceful about that. Give yourself grace. Other questions? Yeah.
Hi, my name is River. I'm a first year, so I'm definitely like, you know, just starting out. But even as like a first year, I think I've had conversations with people who are pre-med, and one of the biggest concerns that seems to come up for them is how they want to pursue their own passions, but also like a work-life balance. Like, oh, like, you know, I want a family, but I really want to go into surgery, and I'm not sure how that will work out for me. Like, how did you like balance work and life, or how have you seen your colleagues balance work and life?
Beautiful. What a great question. Yes. So the first thing that I will say is that the space that takes up the most intensive time is patient care. So as long as you have time for research or teaching, the schedule, I guess, for like an instructor is much more flexible for a family. For a researcher, much more flexible for a family. So if you have little aspects of that, it really does help you balance it out. So most of myself and my colleagues, that's how we balance it out. But for those that are, let's say, I'm purely a surgeon, like that's what I'm doing, it's working in a clinical team or working in a hospital system that has multiple providers giving that same aspect of care, so that you can actually negotiate your time in the clinic or in the hospital or whatever it is that you do. You do have the freedom to do that, and they are not going to want you to know that. But know this, you can negotiate your terms after you finish residency and fellowship, of course. But you can negotiate your terms. You can say, yeah, I'm only going to work 80%. I want 20% of time just for my family, which would turn into 1 day. So you work maybe 4 days a week instead of 5 days a week, or 6 days a week instead of 7. You can do things like surgery. People that are thinking of work-life balance in surgery, they're usually in like the trauma surgery, because it's scheduled. Like, I'm here from this time to this time. If a trauma comes in, we're gonna chop it up, fix it up. But when I'm out, I'm out. If you're a general surgeon, it's a little bit more like demanding in terms of your schedule. So kind of looking at different ways of practicing, for example, surgery, which is usually the most schedule intensive. And for those who don't have any fears, you know, sometimes they go through, let's say, neurosurgeons, have a neurosurgeon colleague. So she went through all the training, did all the work, and then after a certain point, she just put her hours down. When she started to have kids, she's like, okay, I'm not gonna work every single day of the week. I'm gonna do less of the work, and hopefully, you know, she has a good partner that they don't need all of the money that they're getting, which, you know, neurosurgery is highly paid, so she saves enough money, I guess, to do that. But you can do that. You can make your schedule change, and then learn new skills to bring into your space, your clinical work, your patient work. But usually the way you protect work-life balance is by having some portion of your work not be fully clinical. But if it's fully clinical, then you shouldn't do it alone. You should be in a group of providers like pediatricians or cardiovascular doctors that do the same work, so you can cover each other. And you can say, okay, I'm gonna take off next month, and patients will still get the care that they need. You're welcome. And then a lot of the work-life balance comes from you too. You know, taking good care of yourself. Again, knowing yourself and giving yourself grace, and knowing I'm overwhelmed, I can't work 7 days a week or study 7 days straight, I need a break. So you'll respect that when you're a doctor as well. So don't let the outside system help you work-life balance. Always take care of your own work-life balance, because it can look different for you than for other people. Like, I can read and talk to patients for 7 days straight. I'm like super invigorated. Other people are like, whoa, if I talk to a patient, I'm burnt out like in 2 days. So whatever works for you, which experiment with it, and you'll find that balance too. You're welcome. Yeah. Any other questions? Yeah. Yeah, please.
Hi, I'm Joseph.
Hi, Joseph.
Thank you so much for your presentation. I just had one question, or two, I guess. But what are some of the biggest challenges that public health is facing right now? And sorry, follow up is what do you think will be the biggest public health challenge for our generation and the generations ahead?
Oh dear. So I think the biggest challenge that we're facing as public health is the context of public health right now, where it's going. Public health used to be something that's so naturally respected and honored throughout systems, and now because of some of the probably changes you're very well known about, or you know about, there's less consideration for it. So as public health doctors, we have to fight a lot, and we have to do a lot more representation of patient and community needs than we did before. So they're saying, we only have $11 million to do all this work, and that's it. So they're kind of cutting back on the funds, and so really optimizing what's most important and what's most helpful is the challenge we're running into now, and making sure that we protect for the next generation the value of public health, because some people are like, well, I don't really care that much about public health. I care about my health and my family's health, and I can pay for it. I don't really care about the community. And so there's sort of I guess, the short-term memory benefits. Like, people don't understand what it's like in other countries where people can't get any health care and what their communities look like. And so we're really concerned about having that evolve in the United States, because a lot of public health work is funded by the government and by beneficiaries, people that care about the community. And that's the biggest challenge we're facing now. I think that the biggest thing I've had to adjust for public health is it's been like humbling, because I used to be able to say, hey everybody, Dr. Nuñez, I'm in public health, obviously you want to help me, obviously, like, I'm doing this great work. But now I've had to pitch to private companies, because they're saying you have to probably talk to the owners of Meta and the owners of Bronson and all these big companies to fund some of the work that we're doing now, which seems a little bit strange. I've never thought that as a physician I'd have to sort of fundraise and smooch with rich people. That's not like what I thought I would end up doing, but I'll do it for the patients. I'll go in there and I'll talk to them. And so that shifts. Not everybody's a fan of it. Not everyone's willing to do it. But I think that, doctor, wearing the doctor hat, it's so precious, but the main thing is adapt. Sometimes it's so unfair. It's like, why do I have to adapt to this stupidity? This shouldn't be this way. And a lot of my colleagues who are very idealistic, or on my path to medicine, were very idealistic and would be so rigid, it shouldn't be like this. They would just get overwhelmed and burnt out. It's like, it is unfair, we have to work with it. What's changing with your patient, you work with it. You want them to take medicine, but they don't, so we're just gonna work with that. So it's kind of being scrappy and being able to make the best out of the situation a lot more than maybe you'd like to, but it's quite rewarding. So in the public health space, we're doing that as well. And for future generations, I think it's the support of that to continue to maintain the value in public health, so that public health work is easier. It looked for a period of time that would happen, but it's currently being challenged. And so since you're all interested in public health, you guys are the heartbeat of everything that we do, because you're the future. I'm gonna retire someday, and you guys are gonna take care of me, whatever specialties you do. You're gonna help me out. Oh yeah, Dr. Denise, talk to me. Well, let's help her. Let's give her the statin or whatever it is that she needs. And then you'll do public health work, and I'll be like, my captains, we pass the baton, and you're doing amazing work. You have the benefit of technology and aspects of innovation to really revolutionize public health if you decide to. So do it, make me proud. I'm very excited for what you're all into, what you're all going to do. Any other questions?
My name is Caitlin. I remember when you did your presentation, you were saying about how sharing personal outcomes really is something that patients appreciate. And I was curious how, especially working at a community hospital, how did you still connect with patients even maybe if they didn't have the same background as you?
Yeah, that's a great thought. I think that at the end, we're all humans, and we all want the best for our patients, and patients can feel that. Sometimes the doctors, they want the best for the patients, but they're overwhelmed, or tired, or they need to get out of there. That's fine. Patients can feel that too. But I think the first thing to connect with patients on is really showing them, I'm really here to honor you. I'm really here to support your health, and it's an honor to be in this room with you. I worked really hard to be here, and I'm gonna make the best out of it. And I think that first step connects with really any kind of background, any kind of personal experience. And then If you're a long-term provider where you know your patients, oh goodness, you'll find so many things in common. Like, oh my God, you're obsessed with pasta, so am I. Oh my God, I cut my own pasta, I would roll out my own dough and all that stuff. So you'll find things in common. We have more in common than we think, but there are people that really strongly identify with their ethnic background or their religious views and things like that. And that's okay if you don't agree. I think as long as you show them that even though we're different, or perhaps you have different views on how I tire myself because, you know, I eat meat or fish or whatever it is, I'm still here to honor that relationship that, you know, we just happen to have because I trained in this field. So I think that that's always like, you know, the kicker for patients for me, that I bring that energy in. I do start every patient encounter with just a moment of like gratitude, like thank you that I'm here, thank you, and then I kind of walk in with that energy. Like before I came in here, I was like thank you for the students I'm going to speak to, thank you for the opportunity, so I can come in here and give you, you know, my gratitude. I think gratitude is a great way to bond with people and with your colleagues too, even when they're tired, especially when they're tired. I'm grateful for you, go to sleep, here's some coffee, you know, that kind of thing. So yeah, you can definitely bond with patients. Can patients be rude? Can patients not care about that? Sure. Sometimes patients are in the worst moment of their life and they don't want to connect with you. They just want to survive, or they want to see their child, you know, get out of this situation, and that's okay. That's such a privilege still to be there to guide them through that tough time. Usually they'll come back and say thank you for being so kind to me when I had the worst time in my life. So, and I see you have it in you, so it'll be great. Hopefully you guys all come to this field because we need all of you, we need everyone. Yeah?
Sorry, I have one question.
Yeah, please.
I'm sure you've seen like a lot of stuff in the system that's made you like kind of almost lose faith in the system, and like it's wonderful to be like, oh, I can be the change, but like beyond that, like how do you cope with feeling like you don't have a lot of faith in the healthcare system, kind of like what you were talking about earlier?
Yeah, absolutely. What a great question. Oh my goodness. It's variable based on like what's happening and how you feel about it, of course. But I would say when I've seen things in the healthcare system or in the system in general, educational system, that I didn't like, what I learned was not to like fight it initially, to try to understand it. Because if you're not there to really see what it is, who knows? You didn't even know that was an issue. Now you see something unfair. Now you see something inappropriate. But don't judge it first. I would say like, huh, interesting. They just kicked somebody over there. I wonder why that is. Let me just investigate. Let's see. Before we freak out, start crying, screaming that something bad happened, let's examine all the information, get all the data that you can, and then see what is needed to change that. And are you willing to do it? It's okay if you're not willing now. If you're like, you know, bookmark that. I got to get through residency right now, or I got to get through med school right now, but I'm going to make a note of that and have a conversation with someone who you think might notice that. You know, like maybe your supervisor, or maybe your professor. Like, I noticed that ankle kicking is something here at UCLA. Like, what do you think of that? Have you seen that? I saw that. You know, someone that you trust, of course, because people that want to ignore that because they know it's unfair may not be so open, but someone that, you know, you feel comfortable with, ask them about it. They may tell you, we've been trying to fix that for years. If only someone X, Y, Z, and then those usually are the solutions. Someone that's been experiencing it, noticing it, seeing the evolution of the problem can really give you the keys to fix it. If there's no answers, it's a totally new problem, that's okay too. I would say just stay aware of it and then see where you can intervene. Sometimes you can intervene right there, but I would observe it first and see what you can do from like the best, highest, most effective level if you have access to it. I wouldn't necessarily let that get me down because we need you. You know, like if you stay there so upset that that unfair thing is happening, then you won't get through. It will be too painful. You might not even have the will to study. And I found that in residency, if people were disrespectful to others, I would get overwhelmed. I was very upset if I saw like a patient yell at a doctor or a doctor yell at a student, or I was like, I can't. I had to kind of learn to like cope and use strategies, like to talk to the student after and be like, don't worry, I'll take care of it. I got you, okay? I got you. Like whatever I can do on a level that's functional for me. Because if you try to swallow the whole problem and solve the whole problem, it can swallow you whole. It can be quite big. And sometimes it's designed like that. Like they create these things that are unfair to kind of slow us down or to distract us or to just make it easier for people who don't care to get through, and that can be systemic. So observe, question, get some advice, and then decide where you want to help, if you're willing to help at that time. And you can make it part of your career mission as you go higher and higher in your fields. As you ascend, you have more power to say, I'm not having to happen in the hospital anymore, period. So like, let's have a conversation about that. But sometimes as a student or as a trainee, you can feel like, I just give up. It's too much. Like, but you can definitely make an impact. It's just being strategic about it. And so sometimes for some people it's during medical school, some for residency. Sometimes they say, I'm having my kids during residency right now. I can't do any kind of systems-based change, but once my kids are whatever, they're in third grade or first grade, I'll be able to work on that more. So it has to work for you too. It has to be functional and sustainable. If you light a fire outside, for something, that's not sustainable. What's sustainable is what you can change in the system. And preventive medicine helps to teach you that. But public health also helps to teach you that. It's impacting the system. So what in the system made that happen? What in the system can be changed? So kind of being a scientist about it as best as you can. And observing it, not letting it get you down. And knowing that it bothered you because you're amazing. You don't want to see that, and that's good. But don't let that stop you. Because it happens a lot. It does. It's sucky. Yeah. Good question, yeah.
How do you handle like a patient who isn't okay with like your recommendation, like a patient who won't get the measles vaccine or like won't stop smoking even if they have a lung condition? Like how do you deal with that?
Oof, great question. Yes, that can come up a lot, especially in adult medicine. So in adult medicine, it's really respecting their freedom. If they want to see their way to the grave with their cigarettes or their way of life, okay, like they have the right to choose something that is completely impractical and unfair for their health. When it comes to things like vaccines, medications, it's a little bit more nuanced because why are they refusing it? Meeting them where they are. Sometimes even if it's painful to do so, but sometimes it's just having the conversation with the doctor that's open that will allow them to even consider it and maybe do it in 10 years. But why don't you want the vaccine? I know lots of people that don't want it. Everyone has a different reason. What is it for you? What can I help you understand? What information do you need? Do you need information now? Do you even want information now? Ask them what they need. Ask them, what are their fears? What are their challenges about it? And that can help you to provide support information. And sometimes after multiple times of that, they're like, you know what? Yeah, I looked at that. I read what you said, and I see most people are doing okay. But sometimes it's not with you. Sometimes it's with another doctor, and sometimes it's never. But it's doing your part to plant the seed of what promotes their health. But yeah, unfortunately, adults, do what they do. In the pediatric space, since I work in the ped space, it's a little bit more friendly to that because most people want kids to be amazing, healthy, successful, and thrive. So there's a lot of like, do it energy. So if you don't want to deal with a bunch of adults saying, I'm gonna blow my brains out with these drugs, that's it. If you want to deal with more progressive and advancement, pediatrics is a good space to practice because of that. But there are also parents that say, hey, I don't want my kids to get a vaccine. And so depending on the rules and policies of where you practice, you may be able to see them, you may not. There are some clinics that are like, non-vaccinators can't really be in our community because it's not safe. Others say it's up to you. When I've had my own independent will, I just support the families wherever I can. I just keep showing them, listen, I'm on your team. If you don't vaccinate, you know my thoughts about it, if you ever want to talk about it, but I'm gonna help with the colds, I'm gonna help with the cough, I'm gonna help with school, I'm gonna help with behaviors. When they see that I'm on their team and we build trust, sometimes that's what helps them to cross the boundary, but sometimes it never happens, and that's unfortunately okay, I guess, because it's people's freedom to choose, yeah. Even if it's a decision that hurts their health, yeah. Great questions. Any other questions or anything else? Yeah.
This has to do a little bit about pediatrics specifically.
Sure.
But I had the privilege of shadowing pediatricians once, and I didn't realize before, or until I had that experience, that pediatrics is such a holistic practice. So how do you go about treating not just a single patient, but your child who has parents and loved ones who are worried sick for that kid? How do you approach treating not just a single patient, but the entire family, your entire I don't know.
Excellent. No, that's excellent. Just by the way you're thinking is fantastic. You treat the whole family. It is true. It's one of my favorite things about pediatrics and family-based care, that you have this gorgeous little bundle of joy, and then so many people around, or maybe just one person around that's more attentive, that really loves that child. And so the first thing about pediatrics is that the child is a whole individual human being. So it's important that they're happy, they're thriving, they have what they need, and so supporting that and then helping the parents and families to support that is a way to link that up. Sometimes there's of course disagreements between parents and family members, and you can help them align by meeting them where they are. What are the conversations, sort of some of the themes I was mentioning, where if someone doesn't want vaccines and the other one does, you have an advocate. You know, you have one parent that is on board, and that's most likely to lead to what you hope for the child. So kind of meeting the parent that's resistant where they're at, but just constantly having conversations, checking in. And one of the great things about that, about family medicine and pediatrics, is that you have multiple angles of everything. So it's not just the patient telling you, I'm pissed off. You talk to the mom, well, he's not pissed off. He's just angry because his girlfriend broke up with him, and you know, he's just like eating pizza all day. And like that's what, so you have all these different facets to pull from, which is fascinating and really helps you to know your patient even beyond what they could communicate. So it's actually really, really cool if you don't mind dealing with the drama of families and the arguments that can come up, but that's basically how you do it, checking in with everyone. Everyone has something valuable to provide to you, and for the most part, especially in pediatric care, everyone wants the best for that child. So even if they're like being belligerent or rough or like coarse, they're trying to do the best. Somehow they realize that that might be the way, and you can show them that no, you can actually be straightforward with me. You don't have to fight me about this. You're not going to do anything crazy with your son or your daughter. But it's basically having that overview and constantly zooming in and zooming out and really seeing if it all aligns. If there's some discrepancies, there's usually an issue, which can be, you know, trauma or, you know, abuse, you know, things that can be pretty tough. So it's helpful to see like, wait, the kid looks like this, but the parents are saying this. Something is like misaligned, and you can't always get that in adult care. You may not have that context, so it's helpful. Great. Oh my gosh, I think we're over time, right? Maybe.
A little, yeah.
But thank you so much for your questions. I'm here to support you guys. Reach out if you want to meet, chat one-on-one, get some more guidance. I'm so excited for your careers. You guys are doctors already. You're just birthing those children of doctors and then into your whole fulfillment. So please let me know if I can help you in any way. And we really need you. So come all the way. I'm telling you, you will not regret it. Unless you think you will, then let's talk about it. But thank you for your time.